Good morning, everyone, and thank you for joining us for this town hall staff meeting. I want to acknowledge the fact that many of you have sent in very thoughtful questions, and we're going to do everything we can to get to many of those questions. There are certainly themes associated with the questions, and we feel good about being able to address many of your questions today. But please know that we look forward to continuing to receive your feedback going forward. I want you all to know, and I'm sure you do, that every decision that we're making as an institution is with the health and safety of our community first and foremost. And we're doing everything we can to move through this environment with that in mind. At the same time, we know that you have a lot of anxiety and a lot of nervousness about this pandemic and about its impact on you and your family and on our community. And so we acknowledge up front that this is a very difficult time for all of us. And we certainly acknowledge that with all of our great staff. We have put in place a number of recent policies and decisions, and I hope that you've gone to our website and kept abreast of all of the things that NC State is doing as we move forward. And a lot of the people that have been involved in these conversations and these decisions will be on the line today. Probably one of the most impactful things that we've been able to do, and I'm pleased that we got this authority, is to make face masks mandatory for all of our returning employees and our students in all university facilities and buildings. And obviously that wouldn't be the case when you're in your private office, as many of us are today, or when you're able to socially distance on campus. But we would ask all of our returning faculty and staff and students to always keep with them their face mask. I have my Wolfpack one right over here, and to carry them with you when you're on campus, when you find yourself in a situation where you cannot adequately socially distance. And as you know, Governor Cooper, in his latest executive order, also made face masks mandatory in all of North Carolina. Another critical decision that we made early on was adjusting the academic calendar. And I want to thank Lewis Hunt and Provost and so many others of thinking collaboratively with UNC Chapel Hill and with Julie Casani, our health expert on campus, as well as others across the state, on how a changed academic calendar could be impactful in a positive way for our students and others. We've been working hard on the academic side of the house in trying to figure out how to deliver education as safely as possible and as impactfully as possible. I mean, I will be the first to acknowledge that this is not going to be a normal semester and probably not a normal year for NC State or frankly any other university across the country. But we do want to do everything we can to help our students succeed and do that in a way where they're safe and where our faculty and staff are safe. So please go onto our website and keep abreast of all the reactivation decisions and guidelines that have been posted. I also want to acknowledge before we get started with questions that a number of you asked very thoughtful questions about the current issues around race and systemic racism in our country and issues on our campus and in our community. And I want to acknowledge that is on all of our hearts and minds and is a big part of what the university is working on now with our community. I think many of you probably saw this week, the trustees made a critical decision to remove Josephus Daniels' name from Daniels Hall. And that was a very thoughtful conversation with our trustees, and I'm proud of their courageous action. And I think it speaks to some of the efforts at NC State to really address on our own campus many of the issues that we face. But we're not done. We have a lot of work to do in this environment. And we will have other opportunities going forward for our faculty, staff, and students to engage in meaningful dialogue about race, racism, and the impacts that has on our campus and in our community. But I do want to be mindful of the topic at hand today and spend as much time as possible, dealing with the issue of reactivation in the midst of a global pandemic. And I have many outstanding people with me on the call today, and when they speak, you will see their smiling face, and you will understand how hard they've all been working to help us address your concerns, but really address the issues of how do we open our campus and do it in a thoughtful way. Amy Orders, our Director of Emergency Management and Mission Continuity, has been one busy person for always, but certainly the last 100+ days, her life has been, like all of us, has been focused entirely on this issue of the pandemic and its impact on campus. We have Dr. Julie Casani, the Director and Medical Director of Student Health Services here at NC State, a tremendous leader in the overall space of public health. And we're just very, very lucky to have her at NC State always, but in particular during this critical time for our university. Lewis Hunt, Senior Vice Provost for Enrollment Management and Services, has been equally busy, and we'll hear from Lewis. Doug Morton, our Associate Vice Chancellor for Facilities, has really been working thoughtfully with department heads, faculty, and others on how do we prepare classrooms for the in-person instruction, as well as working hard to make sure that our facilities are maintained and managed well in an environment where many of us are working from home. And I want to thank Doug and all of his facilities people that have been working throughout this crisis. Dwayne Larrick is with us from the Provost Office to answer all things provostial, and we're grateful for his presence. And Dave Rayner, the Associate Vice Chancellor for Environmental Health and Public Safety, and always Charlie Mamoni, our Vice Chancellor for Facilities and Administration, is on the line. Many of us from the cabinet are here and will engage in this conversation. You'll hear from Janice Sitsis, the chair of the Staff Senate, in just a few minutes, providing outstanding leadership with the staff. But first, let me turn things over to Charlie Mamoni, Vice Chancellor for Finance and Administration, for his comments before we get started.
Thank you, Chancellor Woodson. I'd like to express appreciation for the staff members, many on the call today, who have been working very hard during the past 4 months, both on campus and remotely, to keep our university running. Even with classes moving online and most employees working from home, our departments really never stopped providing campus services. In fact, with all the changes happening, we still had about 700 students living in residence halls throughout the spring. Actually, some of them are still with us today. Of course, many of us moved quickly to remote work settings, really within a matter of days. And I wish to recognize the Office of Information Technology and their staff, along with many others who supported this transition for thousands of university employees. With the help of human resources, we've ushered in many new required HR policies governing work status, leave, and travel. One of the first steps we took back in March was to set up a crisis command center and establish an operations group led by the Emergency Management and Mission Continuity Director, Dr. Amy Orders. Under Dr. Orders' leadership and in conjunction with other crisis experts across campus, this group has advised the Chancellor, the Cabinet, and executive committees throughout this pandemic, and will continue to do so as we plan for fall opening. It's important to remember that as a North Carolina public university, North Carolina State is obligated to adhere to state policy regarding employment, benefits, financial matters, of course, the governor's executive orders, along with policies and directives that come to us from the UNC system office. In order to do this and safely operate the campus, several task force groups have been set up to address ongoing operations, interpret policy, study reopening strategies, and ultimately determine the best way to return people to campus. Over the last 2 months, we've been working to reactivate the research enterprise, also our industrial and agricultural extension services. Experience with these programs has been both successful and extremely helpful in planning for the fall opening. A great deal of preparation has been completed and much more work still needs to be done. I thank you again for all that you are doing, I thank you for joining the call today. And now let me introduce our chair of the Staff Senate, Janice Sides.
Thank you, Charlie. Good morning, Wolfpack family. First, I would like to thank Chancellor Woodson and the NC State leadership team for this opportunity to collaborate with them as the university gets ready to reopen. We appreciate their willingness to tackle the challenges head-on and their transparency in doing so. During these uncertain times when we are all living with anxiety, stress, and unfortunately for many, fear, Staff Senate is here to advocate on your behalf and proactively work with university leadership to get answers. Staff Senate is a communication conduit between NC State staff and university administration, receiving input from staff members while also providing staff with information and resources to help foster a welcoming, equitable, and inclusive work environment. We work in partnership with the Chancellor and university administration to simultaneously understand the needs of employees and the institution. Today's town hall is in response to staff concerns brought to the attention of Chancellor Woodson. Staff Senate also raises your voice at the system level through participation in the UNC System Staff Assembly, a body that represents the concerns and interests of the 17 campuses that comprise the University of North Carolina. And your voices are heard. Staff Assembly has been holding specially called meetings to address the HR-related issues surrounding COVID-19. And on June 8th, the chairs of the UNC System Faculty Assembly and UNC System Staff Assembly, along with the president of the UNC Association of Student Governments, issued a joint memo with a message of solidarity against racism and calling for strategic short and long-term action. The following day, interim UNC System President Bill Roper and UNC Board of Governors Chairman Randy Ramsey responded, announcing the creation of a task force to examine racial equity issues and make recommendations to the system for addressing them. So please continue to use Staff Senate as a platform to have your questions and concerns addressed. I do not wish to take up too much time, seeing the purpose of today's town hall is for you to receive answers to your questions. I invite you to take advantage of Staff Senate to make your voice heard. Please visit our website, staffsenate.ncsu.edu, to learn how you can engage with us. We are here for you. In closing, I would like to once again thank Chancellor Woodson for his continued support of NC State employees and his commitment to keeping us well and safe. Staff Senate and next year's chair, Pat Gaddy, will continue to partner with Chancellor Woodson and university leadership around NC State's reopening strategy. Thank you, and go Pack.
Thank you all for those remarks. Now we'll get started with our Q&A. Chancellor Woodson, we've had several questions around campus testing, what's available on campus, and if students and employees will be tested when they return to campus.
Well, thanks, Maggie. And Janice, thank you for your comments and everything you and your colleagues are doing in the Staff Senate. Testing is a big issue and something that we've talked a lot about. And we're very fortunate to have Dr. Julie Cassani as a leader here at NC State. So let me turn to Dr. Cassani to talk a bit about our strategy for testing. Julie?
Sure, and thank you. And thank you everybody for joining in. I know that many of these questions have you very nervous if you don't have the answers. So hopefully we can get this information to you today. So a viral test, or also known as an antigen test, can tell you if you have an active infection with coronavirus or if you are an asymptomatic or even a pre-symptomatic carrier and therefore potentially infectious to other people. So NC State has been and will continue to do viral testing on symptomatic students who come into student health services. But we also conduct viral testing as part of our contact tracing program. And that program, as many of you may know, includes students as well as faculty and staff, and identifies if they've had close contact with someone on campus and who has tested positive. Right now, we're not planning on doing a random tests of people who don't show symptoms in our campus community. And that's because even with the most active testing center, we could only test about 300 to 400 people per day. And with the size of our campus community and our campus population, testing just can't be completed at anywhere near the level to be meaningful, effective, and realistic. Outside of the campus, outside of the contact tracing program, employees should seek information and advice from their healthcare providers about testing for themselves. But it's important to know that other than testing, there are good ways to keep the campus community safe. And we encourage everyone to follow risk reduction guidelines like wearing face coverings and physical distancing, to monitor yourself for symptoms daily before going out and before coming to work, and to self-report and cooperate with our contact tracing program to stop any potential spread. Right now, you know this, personal responsibility is really what it's all about for keeping our campus community safe. Wear face coverings, wash your hands often, don't come to work or go to class if you have COVID-19 symptoms, and instead call your healthcare provider. So I think that probably sums up a little bit about testing on campus right now.
Great, thank you. Can you explain how the contact tracing program will work?
Sure.
Go ahead.
Sorry, and we're actually very proud of it, so that's why I get very enthusiastic. Sorry, Chancellor. So we really established this program, and it really relies on, again, personal responsibility. So we encourage strongly, and we rely on people within the NC State community, faculty, students, and staff to confidentially self-report either positive COVID-19 testing, or if you've been given the diagnosis of COVID-19, even the absence of testing. And sometimes testing is hard to get in the community. And so sometimes healthcare providers will tell you you have COVID-19, even in spite of not having a test. We have confidential online forms that you can fill out, and you can get them through the Protecting the PAC website, or if you don't have access, you can call Student Health Services directly. If you're diagnosed with COVID-19 and you enroll in the contact tracing program, a member of the contact tracing team, who are healthcare providers, will work with you to identify everyone you've had close contact with going back 2 days before you started symptoms. That gets us a very broad sense of who you might have been in contact with while you were infectious. This could include people you work with, people you socialize with, and the people that are in your household. We then reach out to those close contacts without identifying who you are. So we don't want to create any stigma. We don't want to create panic, anxiety, and perhaps label people in the wrong way. We offer guidance and resources, and if they are employees, we direct them to the HR website for leave resources and other items that they may need. We give our recommendations regarding quarantine, and that quarantine is for 14 days. And then we monitor and follow people for 14 days through a questionnaire, and we monitor them for symptoms for all of that time. Of course, if people then develop symptoms, we can refer them to healthcare providers if they don't have them. And if we feel that it's necessary, we can provide testing. It's important to remind everybody here on campus that we don't provide acute care or testing for faculty and staff, except as part of that contact tracing. So thank you.
Aggie?
Our next question is, will I have to wear a face covering on campus?
The short answer is yes. As you all know, Governor Cooper has recently enacted required face coverings for the entire state, but our face covering requirement on campus will certainly likely go beyond, in terms of the calendar, anything the state requires. So the answer is yes, with a few exceptions. Those exceptions being when you're in your private office space, or when you're outdoors and you have the opportunity to be greater than 6 feet apart with others. We, of course, encourage everyone to always keep a face covering with them so that when they return into one of our buildings or find themselves in a situation where they're not able to socially distance, that they can put on face mask or face covering. The face covering, of course, should cover both the mouth and nose. The university is working actively to source face coverings for those that need them. We will work to provide them, and through facilities and other organizations, we're working to think about what a distribution model looks like, where they will be located and where people can access them. Amy, you want to add anything to that point? Because I know you're in the middle of thinking about how we might be in a position to provide face coverings for those that need them.
Thank you, Chancellor Woodson. Good morning. So the university has a supply available, and we're actively distributing face coverings through a request model with our partners in procurement and business services. Anyone who's actively on campus at this time, a mandatory on-site employee, staff, faculty, can request masks. The distribution model makes them available on short notice, or we can provide those when you're planning for people returning up to 2 weeks in advance. We'll continue to have that supply for up to a year. We feel that this is a great partnership, and we'll be able to have that for as students return to campus as well. Thank you.
We also know, Amy, that a lot of you will want to express your personal taste in face coverings. And as long as you do that with your mouth and your nose covered, we're going to be excited to see what you all look like going forward. So Maggie, it's coming back to you.
So we have a related, we have a related question next. How will you enforce the requirement that everyone on campus wear a face covering?
Well, I'll start this, but Marie, you and Lisa, I hope you're prepared as well on the student and the staff side. Let me start with what we're not going to do. This is not going to be an issue for the police. This is not going to be the university giving you citations and arresting you for not having a face covering. Honestly, what we really need is for everyone to take the personal responsibility for this to become a community standard and for us all to hold one another accountable for protecting the pack. And now, having said that, this is a policy and it does require being adhered to. And on the student side, let me turn to Lisa and talk a bit about how we intend to manage this with students. And then I'll turn back to Marie Williams to talk about on the staff side.
Thank you, Chancellor Woodson. Yes, we are expecting that all members of our community will do their part to keep themselves and our colleagues safe. And specifically for students, we're in the process of creating a rule for requiring masks. That will be part of our community standards and expectations. But as Chancellor Woodson said, we really are taking an educational approach, and we are really going to be appealing to students to uphold our standards and do what is best and what is healthiest for our campus community. However, if a student does refuse to wear a mask, then they will be subject to disciplinary action under the Code of Student Conduct. We are expecting students to wear masks in the classroom. If a student refuses to do so, the faculty member can ask them to put on a face mask. And if they still refuse, then the faculty member will have the ability to instruct the student to leave the classroom. But again, the hope is that we're going to be able to create an environment where everyone is wanting to do what is best to protect our pack and to wear face coverings.
Thank you, Lisa. Marie?
Yes, good morning, Chancellor Woodson, and thank you, Lisa. Our same as on the faculty and staff side. You're wearing face coverings will be important to promote this health and safety standard that we've been talking about. And so our approach is to not use a punitive approach as much as possible, but really to try to encourage this community standard expectation. But we recognize there are going to be times, we hope that few and far between, in which we'll have to use punitive actions. And so disciplinary actions could be a potential, but that is not going to be our first line of attack when we're having to talk about face coverings. In terms of employees not wearing masks as required, will be asked to put one on. And if they do not, they could be asked to go home. But if you have a special consideration regarding wearing a face covering, you might need an ADA accommodation, or maybe you're a high-risk individual, we are developing a special considerations process, which will be available later in July for your use. And so we know that has been a big question, and we're now facilitating a process to enable you to be able to interact with HR, OID, and environmental health and safety, as well as student affairs on many of these issues. Thank you.
Thank you, Marie. And the only thing, Maggie, if you'll give me a second to add to that, is that I want to make it clear to our campus community, while we want this to be a community standard and we want us to hold one another accountable for the community standard, I think it's important that if you're concerned about a colleague not wearing a face mask, or if students are concerned about another student not wearing a face mask, there are other ways to report it through the university rather than taking it on individually as a responsibility I mean, we don't want people to become, to have fights over face masks. I mean, I've read some amazing things about people in grocery store lines that are having these knockdown, drag out fights over face covering. And I think the most important thing for us as a community is to report through the appropriate channels. And if it's an employee situation, then that would be through supervisors. And if it's a student, it would be through DASA, through the Division of Academic and Student Affairs. Sorry, Maggie, just had to get that out there. Thank you.
We have one last face covering question. Are face shields an acceptable alternative to face coverings?
Okay, Julie.
Well, this time I waited, and part of the fun of my job is I get to have visual aids. So in general, the answer to that question is no. Face shields are intended to be an additive layer of protection and not a substitute for face covering. So this is a good face covering. And as you can see, there is a lot of seal that goes on. And so the intent of a well-fitting face covering is to actually minimize the spread of droplets from your breath and protecting others from you. If you have a face shield like this, it provides a barrier, but you can see that there's a lot of opening on the sides and underneath. And so it doesn't fully protect everybody. And honestly, we don't have a lot of science to prove this to people and to even ourselves as we're trying to make policies about this. And there is science that's developing. This opinion may change and this recommendation may change in the future. And so we will keep you up to date on whether or not it does. But right now, in general, the answer is no. And there may be special circumstances that we look at to work with this guidance. So thank you.
Hey, Maggie.
Our next question is, will the university notify the campus community when someone on campus tests positive?
Yeah, let me turn to Brad Bolander, our Director of Media and Marketing and the spokesperson for the university. We've thought extensively about this issue, and I'll turn to Brad first, and then I'll probably jump in, Brad, but go ahead.
Please do. Happy to answer this. Our primary means of notification will be through the contact tracing team that Dr. Kasani talked about. It's a very robust program. They will identify people who have potentially been in contact with the COVID-19 positive individual, and as she described, work to contact those folks, give them the advice that they need, follow up. Now, if there are cases where we can't easily identify everyone, if it's say there's a fraternity party or pickup soccer game or a random person in a building, we will of course notify larger groups of people, such as all employees who work in a particular building or folks who live in a particular building. And of course, anytime we need to, if the community experiences a surge in cases that really affect our ability or the concern of our ability to safely work and learn and live on campus, we won't hesitate to do all campus notifications. So really bottom line, we're going to work with Dr. Kasani and Dr. Orders, err on the side of caution and use whatever means we can and we need to inform, protect potentially infected individuals and in the broader campus community on a case-by-case basis.
Thank you, Brad.
Sure.
Maggie?
We had several people ask, how will you decide if and when to reduce campus operations again during the fall semester?
Well, this is a complicated issue. And so let me start by acknowledging that many of these decisions are not ours to make. A lot about the potential changes in the function of the university or operation of the university is really a system level decision. The UNC system is committed to working collaboratively. The chancellors meet with the president at least once a week to talk about issues. So I want to start by reminding everyone that we're part of a single system of public higher education And so that system has a big role in this question about if we change operating procedures or if we change status, we do that collaboratively. And of course, let's acknowledge that state government and the governor's office has a good bit to do with this as well. So it's a difficult question to answer because it's not our decision to make in many cases. But I do want to, thanks to the work of the task forces that have been active over the summer, we do have guidelines for reactivating campus operations in a way that does work hard to reduce risk to our faculty, staff, and students. And I will be the first to acknowledge that these guidelines are evolving. They change with, we are dealing, I can't say this enough, we're dealing with a global pandemic, and the status of that pandemic changes almost daily, if not weekly. And I think you all know that the US right now is still surging in parts of the country. So it often is impacted by things outside of our control. We could reduce campus operations again in the fall if we reach certain challenges with academics or with campus operations. But when we do that, or if we do that, it'll be done thoughtfully with our team led by Amy Orders and Julie Casani and others, and be done collaboratively with the UNC system. It's difficult, and Julie, I may ask you to respond to this just before you get your sip of coffee. It's difficult to put a threshold number. I mean, a lot of people are suggesting that what is the critical number of people or the number of programs or whatever that would change direction. And in listening to Julie and others, it's just a really difficult question to answer, and frankly, probably not that meaningful. But let me turn to Julie to add actually an expert's opinion to this.
Thank you. And yeah, some of you know I've actually studied this for years, even prior to coming to NC State. And this has always been the most difficult question in public health and disaster preparedness. You know, when do you close schools? And so do you measure the amount of illness you have on campus? And it could be that in one part of campus, that amount is more important than others, critical services. Is it in housing because we just can't support students within the housing when they're sick and in their self-quarantine? So there are lots of different factors and moving parts to this. And unfortunately, sometimes the answer is, you know it when you get there. And hopefully we can be prepared in where that place is and what actions to take along the way. And I think as we've learned through this pandemic, it's actions along the way that help you not to get to that point where you have to shut everything down if you can help that. So I think that that's where we'll be moving the next actually a couple of days, if not weeks, in trying to develop those thresholds and those actions to prevent the most severe restrictions, because that would be really very difficult for everybody, both socially, mental behavioral health wise, and also of course structurally. Thank you.
Thank you, Julie. Amy, do you want to add anything to that?
I think people look for the information to be available, and when we share out the communications, to Julie's point, it is an evolving situation, and we try to address the practical and operations questions as quickly as we can. So we appreciate people asking the questions and knowing that it does change dynamically. Bear with us. We're giving you as current as possible information is available.
Well, the only thing I would add is that I want you all to know that that as a chancellor of the university and the leadership team that I work with every day, if Dr. Casani and Dr. Orders and others are giving us advice that is based on current environment at the university, we're going to do everything we can to use the influence of NC State on the system office as it thinks about how the UNC system is responding to make sure that we continue to protect the PAC. And just know that we're going to constantly be focused on the data, the science, and use that to try to influence and inform the system office that's thinking about this collectively. So Maggie, I'll go back to you for the next question.
Next question, is how is the university accommodating older employees, employees with underlying health conditions, and other high-risk populations?
Well, let me turn to Vice Chancellor Mamoni and Associate Vice Chancellor Marie Williams to talk a bit about that from an employment standpoint.
Thank you, Chancellor. I think first I would share that we have taken this very seriously. This is an important question to us. And actually many of the policies and practices that we've put into play were actually designed to help and protect everyone on the campus, but certainly recognizing that there are high-risk populations. We're really trying to develop a centralized process for managing these. And I would ask Marie maybe to help. I know she mentioned this just a bit before, but if you don't mind saying that again, Marie, and describing some of what we're doing, that would help.
Yeah, happy to, Charlie. As Charlie has indicated, I think if there was a number one question that I sense from the HR standpoint is the anxiety people feel around returning to work. And as you'll hear throughout today, there is lots that we are doing to ensure the health and safety of our employees. But we understand also that there are employees who may have underlying health conditions. And so this process that Charlie is referring to is a centralized process that we're developing with environmental health and safety, with HR and OIED, and also working with student affairs. And primarily it's going to be a centralized process where you can just ask a few generalized questions about your needs. And those needs can be related to maybe you're in a high risk category, or you have childcare concerns, or you want to make a request to telework or to work on site. You will just ask a few basic questions. You will not be asked any health information. That information, if we need documentation related to a health standpoint, that will only be asked of you by OIED and or HR. And so you submit a request, a bit like an intake form, and then it will come to HR and OIED confidentially, and then we will handle it accordingly. The reality is each situation is going to be very nuanced. And so we're committed to working with our faculty and staff on a case-by-case basis, and we'll be working closely with the college leads and also the deans and supervisors of colleges and administrative units as we navigate this issue. But do know we understand the concern and that we are here for you, and we'll address and resolve those concerns as promptly as we can. Thank you, Charlie.
Thanks, Marie. Maggie?
Our next question is, with so much changing in the workplace, how is NC State working to evaluate and correct possible bias in the opportunities for promotion and fair salaries?
Well, I'm going to ask both Sherry Schwab and Marie Williams to respond to that. And you guys decide who goes first.
Oh, well, I can start, Sherry, if you want. Yeah, so, we take this matter really seriously, and we, as part of our recruitment and retention strategies that we employ at NC State, both the offices of HR and OID, and also in partnership with our colleges and administrative units, we're constantly monitoring our metrics for promotions and salaries, hiring, training, and discipline in accordance with federal law. And so it was important for us to do that because we want to make sure that we're evaluating any disparities based on race and sex and disability status. And that's where I'll kick it over to my colleague, Sherry, who will talk a little bit about that partnership when we're working with OIED.
Thank you, Marie. This is Vice Provost Schwab, and we do work collaboratively to continuously monitor on an annual basis. We run statistics as well as look at individual cases to make sure that we are monitoring that. And then we develop practices to address any disparities we may find, and that is on whether it's on the individual level, again, or systemically. So we have great partnership between human resources and OIED, and we are definitely paying attention to those issues.
Thank you. Maggie?
Will employees facing higher levels of potential exposure, such as people working in food service, housing, and housekeeping, receive additional compensation?
Well, this is a technical answer, and Marie is the right person to give a technical response.
Thank you, Chancellor Woodson. At this time, there aren't any ongoing discussions regarding additional compensation pay for mandatory employees who are working on site due to COVID-19. And I think many of you will recall that mandatory employees were eligible for additional compensation at the beginning of the outbreak, around about March, April, and also part of May. But this policy is no longer extended. But we are working hard to implement risk reduction measures as we reactivate campus operations. It's also important for me to make sure we remind ourselves that the university really has been taking prudent steps to not only educate, but to train and also prepare the workplace for all of our employees. And so you'll hear it today, but some of the initiatives that we've been following, as you've heard about the requirement of face masks to be worn, there is a mandatory health and safety training that will be for all faculty and staff. That's been administered through environmental health and safety. You'll hear a lot, and Amy's already touched about that, but availability and use of PPE. We're also reconfiguring workspaces when necessary. We've been doing that here in HR as well. We understand sometimes people are on the front lines dealing with customers. And so whenever possible, we're looking at those aspects as well. And facilities has been working very closely with all our units as we have to make those kinds of decisions, as well as expectations around physical distancing. And that involves looking at our offices, looking at our classrooms, even our vehicles that our employees use when they're traveling around campus for work, as well as processes for addressing requests, which we've talked about when you have special circumstances. So thank you so much.
Yeah, and the only thing I would add is that, and I think Charlie Mamoni mentioned this earlier, we've had an opportunity to learn a lot about reactivation because we've done it carefully and thoughtfully and slowly. And I see Dr. Mladen Volk on the line, and with research, for example, we've had a very thoughtful reactivation there, and we've learned a lot through that. And the same with other areas such as facilities through Associate Vice Chancellor Morton. So we're learning a lot about this process, but we also have to remind ourselves that we're a state entity, and a lot of the guidelines with regard to the compensation of our employees and the policies under which we operate are determined at the system and the state level. But that doesn't mean we don't constantly advocate for our employees. And in fact, I think we've done a phenomenal job, at least in my view, of being able to keep our employees well compensated through this challenging time. And with that, let me turn back to you, Maggie, for the next question.
We had several questions about the return to work timeline and concerns about returning to work. This includes how far in advance will employees who have been working remotely be informed they need to come back to campus, and will staff continue to be able to work remotely?
Yeah, so I'm going to again turn to Vice Chancellor Mamoni and Associate Vice Chancellor Marie Williams, but I do know everyone's very concerned about this, and obviously we have a lot of forces at work here, including executive orders by the governor, policies from the system office and the state, and we're working hard to make sure that when we know, we communicate clearly, and when we don't know, we ask questions about why we don't know. And so with that, let me turn to Charlie and to Marie to deal with this question.
Thank you, Chancellor. I think, obviously this is an important question relative to health and safety of our staff. And for that reason, remote work is still highly encouraged, and we plan to consider that strategy, an important strategy, well into the fall semester. We really are counting on our supervisors and managers to stay in good communication with our employees. And while, as the Chancellor mentioned, we have a lot of duties and responsibilities to possible policy changes, we'll do our very best to try to keep folks as informed as possible, as quickly as possible as things do change. But we are still under a designation of mandatory on-site employees, and remote work is still highly encouraged, and non-essential campus functions when the university opens in the fall we plan to figure out the best possible way for us to leverage that remote work and keep those functions actively involved in the campus without bringing folks back to campus. Marie, is there anything else you would share?
I think the only other thing is just that even with the reactivation of campus, Charlie, it will still be the discretion of the college or unit to determine which employees will be deemed mandatory or non-mandatory to work on site. But other than that, I think you said everything.
Okay, thank you both. Maggie?
As we return to work, what will NC State do to protect staff who share an office and would normally be within 6 feet of their office mate when in the office?
Well, hopefully many of you that have had the occasion to return to work or the need to return to work see changes in the workplace. And I know through facilities and through each of the individual offices, we've been working hard to stagger our employees when they're required to be at work and to work on the physical distancing side of the office space. And before I turn it over back to Marie, our wonderful Director of Human Resources, who has put the human back in resources. Yeah. I do want to acknowledge that, we're learning a lot through this difficult pandemic. We're learning a lot about different ways of working. We've learned a lot about areas of the university that can work remotely and do so very successfully. And please know that this learning and there are these things that we've implemented during COVID-19, some of which could carry forward when this world returns to some semblance of normality. So, there's an old saying, never waste a crisis. And this is a crisis without a doubt. We all know that. We're all living with it every day and trying to do the best we can to manage our way through it. But we're learning a lot. And I hope that as an institution, when we come through this, that we have some different ways of operating that will benefit our employees and benefit the university. So Marie, HR, here we go.
Thank you, Chancellor Woodson. So I think you really summed it up in a nutshell, but I will just emphasize a couple of things is that, when we are hearing about the anxiety of our employees coming back to work, there are questions around what would it look like if I come back into the office and their workspaces. And I do know I want you to know that the university is really thinking about what we need to do and making preparations for an anticipation of many of the questions that you have. But there are lots of toolkits and resources that we have already provided you, and we'll also continue to provide to you as we reactivate campus. For example, we've been working closely with environmental health and safety on a variety of resources and toolkits for faculty and staff. My office has done a lot around working remotely. So if you haven't done it already, I'll do a quick plug. Please go on our website and look at tips for working remotely or tips for if you're working on site and how you can take care of your well-being and things you can do about scheduling. So rotational schedules, the Chancellor mentioned it, staggering work schedules, compressed work weeks are all on the table as flexible work things that we can do to protect the health and safety of our employees and minimize too many people being in office at the same time, particularly those who are in a shared office space. We have cubicles in HR, and these are the kinds of things we are intending to do in order to protect our staff due to this reactivation. So more to come. In addition, Ursula Heston, our Assistant Vice Chancellor for HR Strategy, is working with a team across campus to also develop a return to work guide where we'll also go into a little bit more detail about scheduling and some of these other kinds of questions that you may have. So more to come, but do know the resources are out there. We'll continue to do our best to communicate those to you, and thank you.
Doug, why don't you talk a bit about what we're doing with spaces? I know we've probably bought as much plexiglass as any organization in the countries.
So in terms of physical barriers, Chancellor, we do have plexiglass that we're fitting for places where there is human-to-human contact, and that's in frequency. So these service delivery points, and we're working with campus enterprises and dining, we're working with student centers and others across the campus to make sure that those are uniformly applied in all these applications, provide the protection for those folks.
Thank you. Maggie?
There were several questions around possible school closings and childcare due to COVID-19. How much flexibility in terms of work hours and leave is available for staff who have children in schools or daycare centers that have not reopened, or who have school-age children with staggered schedules?
Well, these are certainly big issues for many of our employees. And acknowledging that, let me turn to Vice Chancellor Mamoni and Marie to talk about what we're doing specifically in these areas.
Thank you, Chancellor. First, I'll say that, this, just like the health and safety issues, is a critically important concern for us. And we're watching very closely what the school systems are doing and planning. And we do know that it impacts a large number of our employees. I'll ask Marie to speak, specifically to some of the administrative leave and other services that are available for individual employees to take advantage of. And I hope they will work, with human resources to figure out exactly what that best condition is. But we're really trying to, fold in many of our strategies around remote work, alternating schedules, and really think that both for health and safety reasons, but also for some of these outlying conditions that really do affect families, that we may be able to address some of that as we move closer and closer to the fall opening. With that, Marie, I'd ask you to help.
Yes, thank you. Thank you, Charlie. This is a question that we do hear a lot, and we totally understand that, as a mother with children, and I know many of our employees have children and childcare needs. And so this is something that we're closely monitoring. As you know, this is something that I'm very passionate about. And as the university and leadership understands the many constraints that individuals have while working, whether working on site or working remotely, and also having to manage schools being closed and childcare facilities being closed. But I want to talk to you a little bit, just very quickly, about several leave provisions that are out there from the UNC system that are out there to help support families during this difficult time. Many of you may have heard of the Families First Coronavirus and Response Act, and Margaret Erickson and our leave team have done a phenomenal job in communicating that information out to campus. If you go to our website, it is complicated stuff, but if you go to our website, there's a chart that will clearly talk to you about our various leave provisions. In addition, we understand that employees also may have, in addition to childcare issues, maybe childcare responsibilities and elder care responsibilities. And in addition to Family First, there's also paid administrative leave, which can be used for up to 12 weeks at 2/3 of your regular rate of pay. And then after 12 weeks, paid administrative leave may be requested at 1/3 of your regular rate of pay. There may be other things that are coming down the line, and what we'll certainly do is communicate to you in such time as the leave provisions are added. And we'll talk to you in a little bit about something that will be added to help alleviate some of the concerns, but more to come. But as Charlie indicated, we're closely monitoring what schools are doing, and we'll certainly will keep you updated on whether it be the availability of childcare, including what's happening with our own Bright Horizons, who are a great partner with us during this time, new leave guidance, and as well as flexibility to work from home. Thank you, Charlie.
Marie, I'm sorry to throw a curve to you and Maggie, but I know our time is short here, and I want to make sure that you get to the point that you intended to make later about a potential new leave provision that I believe will make a big difference in our employees' lives.
Yes, thank you. Thank you. Yeah, I'll be quick. So thank you, Randy. So good news is, well, this is something we kept hearing as a great suggestion from our employees in the systems office. Listen to our cries from system institutions, and we'll be implementing sometime in mid-July a COVID-19 voluntary shared leave program. So I know when people are worried about, I'm looking after my child and I'm worried about exhausting all of my leave, there'll be opportunities for employees to donate to those employees who have exhausted their leave during this difficult time. So more will come. We're going to be communicating to campus in July, but we're excited by that. Thank you, Randy.
Thank you. Maggie, you're watching the clock, so throw whatever you want to throw at me.
We probably have time for one more answer as long as it's relatively quick. So how will how will workspaces be cleaned?
Okay, that's a Charlie Mamoni and Doug Morton. Doug, you got your hand up.
I'll jump in. The professional housekeeping staff has been working since January when we learned about this disease on how we should clean spaces. One thing that's not going to change is the frequency that we clean individual offices. That happens fairly infrequently, and we're going to ask employees to take care of their own workspaces. We're going to focus as a housekeeping staff on common spaces, high-touch surfaces like doors and break rooms and elevator buttons and those types of things. But we're going to learn, as the chancellor said, as we go along, and what needs to be taken care of the most. And so we're coordinating with all of the building liaisons and facility coordinators to be sure we're getting that just right. We're going to employ hand sanitizer stations at the front doors of buildings, and emergency management, mission continuity, and the procurement office have worked together to create a resupply for personal hand sanitizers. So there'll be gallon jugs of sanitizer deployed in buildings that people can use to refill their own. So we're thinking as thoroughly as we can about the things most important to be clean, but it's really a team sport. We need the people that are in the buildings, occupying the buildings, to take care of their spaces and then call upon the staff when they think something's unusual or they need additional help.
Thank you, Doug. Maggie, are we at the concluding hour?
Yes, I believe that's all the time we have for questions.
Yeah, I'm sorry that we've not been able to get to every question. We'll continue to update the website, and we'll continue to be responsive to your concerns. And Janice, you know how to reach me, and you do frequently. So we want to continue to be responsive to the staff. Let me end by just telling you all how much we appreciate everything you're doing for NC State. Acknowledge what a challenging time this is for all of us, all of our families, and the concern and confusion about how we go forward in this environment. And please know that we as a university are going to continue to do everything we can to give you every opportunity to succeed, to continue to be employed at a great university. That's our first priority, in addition to making sure that we do that with your health and safety first and foremost. So please visit the Protect the Pack website, check in often. We'll continue to update it. Grateful for everyone on the call today. Thank you to my leadership team and the university's leadership team for everything you're doing, and all of our employees. And with that, go Pack.